The most popular plastic surgery procedures, people are permanently changing their eye color. They're also getting what's called the Barbie nose, or the BBL is another popular one. It's known as the Brazilian butt lift. That's still big, and I didn't mean anything by that. Let's bring in, see what I did there?
I got to be careful what
I know. I'll be good. I'll be good. Let's bring in Dr. Matthew Knight. He is the president of Knight Dermatology Institute, a member of the Florida Board of Medicine, and a dear friend of ours here on Good Day Orlando. Great to see you, Doc. How are you?
Thanks for having me.
Okay, so some of these are a little shocking. Changing our eye color?
Yeah.
That seems not safe.
Yeah, so you can take a laser and remove all the melanin in your iris to change your eye color. So if you have, it makes your brown eyes blue. So if you can take all the brown off.
So it's like the song.
It is like the song.
Okay.
And you can, there's a technique, now none of these are FDA approved. There's a technique where you can take dye, almost like tattoo dye, and inject it in your cornea to change the eye color, or put permanent lens covers sort of over your iris to change the eye color. But the American Academy of Ophthalmology has said, no way, this stuff can lead to all kinds of bad stuff, including blindness.
Oh gosh.
But glaucoma and cataracts, and the ink can leak into other areas of your eyes. So, you know, there's the good thing here is that there's one really easy alternative called contact lenses that you can take in and out.
Good point.
Right, they're cheap and easy to use. And these procedures are like 15 grand. You got to go out of the country to get them, and it's permanent. Right, and so if you don't like it, you're stuck with it. And so, like most things that you hear me say, buyer beware.
Yeah, okay, that's good. Well, and the fact that you have to leave the country to get it done, I think that would be a big warning sign.
A red flag.
Okay. All right, so the next one is the Barbie nose. What is that about?
So there's this whole Barbie aesthetic after the movie, a tiny little upturned nose. And there's all kinds of other things in this Barbie core phenomenon, doll-like features. And so there are folks out there getting the Barbie nose, which is where a plastic surgeon shaves off a whole bunch of cartilage to create a tiny little nose. Some people love it. The problem is that it's permanent, and if you don't like it immediately post-op, you're stuck with it. And people's faces change over the years, so you might end up 50. You know, I know I've had it done; it looks great, but you can end up You can end up 50 years old with a little Barbie nose, which doesn't match your 50-year-old face. And there's really no way to go back and undo it. You can try to take cartilage from your ribs or other places to reconstruct this nose, but you're talking like really out there plastic surgery. So, again, before this kind of stuff is entertained, number one, of course, you've got to talk to a board-certified plastic surgeon who knows what they're doing. But remember, this stuff is permanent, and it's right in the middle of your face, and you're stuck with it forever.
Well, and I would think a good plastic surgeon would caution you from doing anything that is, like, dramatic, right? Like, most patients just want to tweak, right? But if you're going for something dramatic, that's like a whole other
That's right, and a lot of this stuff is social media driven. So what's popular, it's like the Macarena, right? Really popular 25 years ago, not so much today. So if you go for this like popular trend you saw on social media today, you know, 35 years later, it's not trendy anymore, and you want something different, but you're really stuck with something like that. You have someone shave off a bunch of cartilage on your nose, that's what you're going to look like the rest of your life. So you have to really be careful.
Well, it's just like when you get, you know, your partner's tattoo, right, and, you know, big place on your arm, and then you break up 2 years later. Now you got to cover it.
And in this case, it's like right there.
Right there in your face.
You can't cover it up. You're stuck with it.
Good point. Okay, the Brazilian butt lift. That has actually been around for a while, but I've not heard necessarily great things about safety part of it. Is that right?
You hit the nail on the head.
Okay.
It is, statistically speaking, the most dangerous cosmetic surgery out there. Some studies have said that 1 in 3,000 people die having this procedure. And the reason is because there's some bad things that can happen, but there's also a lot of people out there doing it, also overseas, that maybe went to a weekend course, you know, and so having these sort of procedures done with a board-certified plastic surgeon with a ton of experience is one thing, but going offshore and having it done at some cheap clinic that you read about is entirely different. The problem is a BBL is using liposuction to remove fat from the abdomen or flank, spinning down the fat and then injecting it in the butt. And when that happens, there's one really bad thing that can happen called a fat embolus. And that's when that chunk of fat travels in the blood vessels and ends up somewhere like the brain or the lungs or the heart, which can lead to death, can lead to stroke and heart attack and death. And even if that doesn't happen, it's a really tough procedure because if you sit on fat, so if you graft fat and sit on it, it kills the fat and it can end up to a kind of a lumpy, uneven appearance, meaning you have to do it multiple times. After the procedure, you can't sit down for several weeks, right? So it's fraught with problems, but there are a lot of really serious complications like infections and asymmetry, and including 1 in 3,000 deaths, just because people aren't doing their homework and checking who's doing the procedure.
Right.
I wanted to add that it's really easy to check the credentials on your doctor. You can go to a bunch of websites. One's called, Is My Doctor Certified, and look to make sure that they're board certified by their specialty board, not some like international board of X, Y, and Z, but like the American Board of Plastic Surgery, and check credentials and check the Florida website and make sure before you sign up for any of this kind of stuff that you know exactly who's doing it and how much they've done and ask the right questions.
And also, interview doctors, right? Go to 3 doctors and make a decision.
Yes.
Don't just, like, oh, my friend said this one's good and go, right?
You have to put a lot of research into it because, these things are permanent. They can have really serious complications, and you always want to talk to a couple of folks. And again, check the Florida Practitioner Data Bank. Look and see if your doctor has the right credentials, if they're board certified, have they been disciplined, what's going on. And then you're right, ask a ton of questions and do your due diligence before you sign up for any of this kind of stuff.
Absolutely. All right. It's an investment, too. It's expensive.
Yes.
It's expensive stuff. Great to have you, Dr.
Thanks.
Matthew. I'm going to be singing Don't You Make My Brown Eyes Blue the rest of the day now.
I resisted the temptation.
Because of you. Thank you, Dr. Knight.